Okay, so we've gotten through the truly 38 weeks, or like doctors like to say, 40 weeks of pregnancy, and now it's time to get the baby out. So, labor. Stage one of labor is the dilation stage. So the cervix needs to go from basically completely closed up to 10 centimeters in dilation so that the baby's head's going to be able to pass. So here we have a mom with a nice, polite baby who's head down. Good babies are head down. All you naughty people whose moms have told you that you were born breech, you were naughty babies who came out a different direction. Here's a good head down baby. What I want you to focus on, and it's hard for me to fully describe because we're just in a video and I don't have any pointing abilities, but you want to be looking at this little area at the base of the well, I guess it would be the top of the baby's head. You can see the cervix. It looks like a little line, and then you can see the vagina going down from there. The cervix is the opening of the uterus, and the uterus is, we've been talking about this endometrial layer that babies implant in. The next layer in the uterus is all muscle, and the job of that muscle is to pull open the cervix through a series of contractions that pull the cervix more and more and more open until finally it's ready to expel the baby. So here we have, you can see in this picture, the cervix just basically looks like a line because the mom hasn't started labor yet. Here we have cervical effacement and dilation, and in this picture you can see baby's head pushing down, and in the left picture really the cervix hasn't started to open or efface. In the middle picture you can see a small opening starting to form in the cervix, and the cervix has gotten significantly thinner as baby's head is pushing down on it. And then in the right picture you can see that the cervix has pulled back and has completely thinned out and gotten out of the way so that baby's head's going to be able to push through. So the cervix is going to go from basically 0 centimeters to 10 centimeters in diameter. Remember, there are 2.5 centimeters per inch. So we're talking about approximately 4 inches in diameter. Go measure something like, let's say, a grapefruit or something, and you realize, okay, that's a pretty big baby head that's going to be pushed out of this cervix. Here's a nice graphic that I found on the internet, common items to compare to the dilation of a cervix. And so it starts out, the size of a Cheerio, and then we dilate to now it's not the hole in the bagel that we're talking about at the bottom there. We're talking about the diameter from edge to edge of the bagel. That would be 10 centimeters dilation. So that's enough to be able to pass the baby's head through. All right, so the process of going from 0 to 10 is that process that causes labor pains. So as the muscle of the cervix, as the muscle of the uterus is pulling back the cervix, it's like any other muscle in your body that, if you're holding something, it makes that muscle really tired and it can make it start to cramp. So as it's going on, it usually becomes more and more intense, right? Because this muscle is doing its last little bits of work. It's really, really tired. It's built up a lot of lactic acid, and so it becomes more and more painful. For most moms, the 0 to 5 centimeters is not that painful. For some moms, however, from 0 to 0.025 centimeters is like death. So there's a whole range of reactions that women have to dilation. For most women, they'll all agree that the last 2 centimeters are the most painful. They tend to be the most intense. The mom's already tired. They tend to be the quickest, so that's good news, but it's called the transition phase because it's that last little bit and it can be the most painful. In the end, the goal is to get that cervix out of the way so that the baby is going to be able to be delivered. In this picture, you see this nice head down baby. He's not only a good polite baby for being head down, this baby's a nice polite baby because it's facing the spinal column of the mom, which is really, really a nice baby because the face is nice and soft and squishy and won't hurt mom's spine. Mean babies face mommy's tummy, and mean babies' little skulls drag along those spinal column, those little vertebrae, and cause back labor that mom wants to get into a pool to not have to feel anymore because that makes the baby buoyant and stops pushing on her spine. So I'm sorry, anybody who was born breech or facing the wrong direction, I'm sorry, I'm characterizing you as mean or naughty. It's not your fault. The delivery of the baby is stage 2 of the labor process. So in a normal birth, baby's going to come out head first. Head will come out, shoulders next, and you notice how the baby's all wadded up. So usually it's pretty easy to sort of manipulate one shoulder to come out first, then the next, so that it all sort of works out between mom's pelvic bones. Here's a naughty baby coming out breech. And this baby, he's still wadded up in the same basic format, but he's coming out butt first. Now there's a couple of reasons why this is a bad position to be in. One is that nice soft set of butt cheeks that's pushing on the cervix is not enough pressure to help with dilation and effacement. So moms who have breech babies may labor for a really long time trying to get the cervix to open up. Another thing that's wrong with breech births is that the baby's body is smaller than its head. And so you might be able to deliver the body, the width of it can really wrap up and be reasonably small. So you might be able to deliver the body and then the head gets stuck. And the baby, when he comes out head first, the round part is coming out first. And so there's fewer things to get stuck on the way out. Whereas when you're coming out breech, you can get stuck on the jaw. And so all those things put together means that if a mom is delivering breech, it probably is going to result in a cesarean section. The final stage, so stage 2 is completely delivering the baby. And so you think, yay, the baby's born. But there's actually one more stage, which is the delivery of the placenta. You might be thinking to yourself, well, why is that its own stage? Well, because a placenta weighs about 4.5 pounds, and it needs to be passed out in its entirety. You need to double check that when it's delivered that it doesn't have any tears or rips or any missing pieces that implies that there's some still embedded in mom's uterus, because that can cause an infection that can kill mom. So it's a very significant stage in the birth of a baby. All right, now when it's time to have a baby, there are all sorts of choices available now, and all sorts of decisions that moms and couples have to make. So for example, who's going to deliver the baby? Most moms make the decision to deliver the baby with a medical doctor, an OB/GYN. But a lot of women are starting to choose nurse midwives, women who are it's not always women, but a lot of nurse midwives are female. They're specially trained RNs who are qualified to deliver babies on their own in the hospital. So without necessarily having to consult with a doctor, they can deliver the baby. A midwife doula is a different kind of midwife. A midwife can be a nurse midwife, or they can just be just solely a midwife. And a midwife is somebody who's gone through midwifery training, and they don't have other medical training necessarily, but they are very experienced in the delivering of babies. Doulas are not midwives. Doulas are birth coaches, and they know how to assist with breathing, and they know how to assist with pain management, and they can keep the mom focused, and they can really be a really big help during birth, but they're not the primary person delivering the baby. A midwife who's not a nurse midwife might deliver at home. They might deliver lots of different places. And if something starts to go wrong, a midwife would call they would take you to the doctor. They would have you taken by ambulance to a doctor. Whereas a nurse midwife is most likely delivering in a hospital, and so there's very quick access to a higher level medical professional like a doctor. Which brings us to the issue of where. Vast majority of babies today are born in hospitals. 98.64% of births are in hospitals. That's actually a drop in the number of hospital births. It used to be for a while there pretty much 100% unless it was completely an accident. But now there are people making other choices. Part of the reason why people are starting to make other choices is because of sort of the medicalization of childbirth. This Monty Python, The Meaning of Life, has a great scene showing this horrible birth experience where the doctors are going to cure this woman of her condition. Don't worry, we'll take care of it. You don't need to help. We'll take care of it. A lot of women were dissatisfied with that kind of medicalization of their birth, and so they started looking outside the hospital. So birthing centers have cropped up, and a lot of times they're attached to hospitals. A lot of times hospitals have birthing centers within them so that you get the feeling of all the stuff that goes along that's beneficial with birthing centers while still having medical professionals available. And that's why it's 98.64% of people giving birth in hospitals, because a lot of birthing centers are kind of counted as hospitals because it's a medical center. It might actually be in the hospital or attached to the hospital. The thing that's neat about birthing centers is they've really brought in a lot of birthing innovations that even hospitals are starting to do now, like giving birth in water. When that was first introduced in the U.S., people were like, "You're going to drown your baby. You can't give birth in water. What's wrong with you? You're going to get an infection, or all these bad things will happen." And what they found is that first off, you're not going to drown your baby because babies are already floating in the amniotic fluid, for 9 months. They're not breathing through their mouths or noses during that time. Babies don't take their first breath until their face hits air. So no, delivering in water is not going to drown a baby. Concerns about infections and things like that turned out to be overblown. There was no reason to worry about that stuff. And then there are these advantages, like the warm water can really help moms to relax so that their pelvic bones can kind of get even farther apart than they might naturally be. Can help a lot with back labors. If you have a naughty baby who's rubbing the back of his skull down your vertebra, being in water can help to make him more buoyant so he gets off the spine and allows for the delivery. I saw a film of a mom giving birth to a 10-pound baby in water without any pain relief, in large part because the water helped to offset the pressure she was feeling. So birthing centers have brought in water births. They've brought back birthing chairs, which allow gravity to help moms deliver in a chair that allows the medical professionals to access from underneath in ways that doctors don't usually like. Doctors want you on your back with your feet in the stirrups so they can see what's going on, right? Whereas birthing centers brought in these other opportunities and options. Including having dad in the delivery room, by the way. That was thanks to birthing centers, and then hospitals started to allow it too. Very small number of people actually give birth at home. The number is growing, but it's a very small percentage of births that are done at home. And a lot of times it's because people are scared. I mean, you never know what might happen in any childbirth. It doesn't matter if it's your first or it's your 19th. You never know what's going to happen in a childbirth. And so a lot of people are like, you know what, I just want the reassurance of being in, a medical setting. Some people don't like the possibility of mess at their house. They're worried about, well, what's my house going to look like after this, right? Which it turns out the midwife or the doula that's there usually has all the preparations to get everything covered up and protected so that that's not even an issue. The key thing is, home birth in a rural setting, you got to have a really healthy pregnancy and really be secure and convinced that you have a healthy delivery ahead of you, because you may have a long transport, and that's it's a scary thing. But these are the main options, right? How about pain medication? Another choice that moms have to make, a decision that they have to make. There are narcotics like Demerol that are available that they don't make the pain go away. They just sort of make you not care that you're in pain. They're oftentimes delivered early in labor so that a mom can maybe relax a little bit more during the labor. An epidural is usually reserved for a little farther along, but there's a limitation on how far along in your labor that you're actually eligible to have the epidural inserted. So you kind of have to make the decision before you get too far dilated, or else they'll tell you it's too late. Because what they do is they insert a tube into the sac surrounding your spinal column, and then they inject medication into that area, and that'll numb below that area. They've gotten really good at these epidurals lately so that they can actually numb just the region where, from your pelvis to, between the injection to the bottom of your pelvis, and then your legs still work. And so that you can still walk around and you can still move during labor, which is a huge improvement in how epidurals are applied these days. In the olden days, if you got an epidural, you were on your back until delivery. So that's a huge improvement. If you ever saw the movie Look Who's Talking, when Kirstie Alley goes into labor, this was the 1980s, and she wants some pain medication. And that nurse who's sitting there reading a magazine, apparently not even remotely concerned about the pain that this mom's in, tells her, relax, you're not in an aerobics class. And then she says, the nurse says, use your Lamaze breathing. What's wrong with you? And Kirstie Alley says, well, I dropped out of Lamaze. I don't know how. Back in the 80s, the attitude was that, if you care about your baby at all, you won't use any of these pain management methods, because it's not healthy for your baby. It's not good for the baby. And there was a really snobby attitude about it. If a mom said that she had an epidural, the other moms would be like, oh, you poor baby. I'm sure the medication's worn off by now, and the baby's 6 months old, Today, we have a much more rational attitude about pain management for moms. We realize that moms who are under a lot of stress are not doing anything good for their babies. And so if she would be under less stress, if she had some pain management, that's an advantage for the delivery. Moms who are tense are not going to progress as quickly as moms who are more relaxed. So, with the better epidurals that we have now and things, doctors, in fact, discourage moms from saying, I'm going to have a natural childbirth. I'm not going to sign any of the waivers for anesthesia or anything like that. They say, you know what, let's sign the paperwork and just, if you can go pain-free, pain medication-free, fine. But if you need it, then everything's already signed and we can take care of it. So, entire change of attitude. Now, I thought I'd show you a couple of situations where cesarean sections are required. If you have a baby in the top left, that's a transverse breech. That baby is not coming out in that position. If that baby doesn't rotate, that baby can't come out. There's no way, right? What's called placenta abruptio is where during delivery, the placenta actually separates from the uterus before the baby's head has emerged, and that means the baby's not getting any oxygen while the baby's in the womb. Similarly, placenta previa is where the placenta is closer to the cervix than the baby is, and so the baby, either the baby's head is going to compress it and deprive themselves of oxygen every time there's a contraction, or the placenta actually gets delivered before the baby, and again, no oxygen for the baby. So in those situations, got to get the baby out. And then, like I said earlier, if the baby's coming out, breech, then almost all the time babies will be delivered C-section who are breech because of the risks. But even in situations where none of that's happening, women have been having what are called elective cesarean sections. So here we have, the doctor saying, so you're due on the 17th, and she goes, I'm all booked that week. Let's go C-section on the 4th. How does that sound? How's 1 p.m. sound, right? She's trying to fit it into her very busy schedule, right? That's one reason why women are having C-sections, because it would work out better for their I've already got my maternity leave planned, and this is when it would work, or I don't want a baby with that birth date. I've heard moms say, well, I wanted an Aquarius, things like that. What we're seeing is C-sections on the rise. And when I had my first child, it was 1993. And so at that time, there was this push to reduce the rates of C-sections, because we were at like 22% of babies being born via C-section. And this was higher than every other civilized nation. And you might be thinking to yourself, so what? It's just a C-section. But a C-section is major surgery, where you're cutting through mom's abdominal muscles, through that giant muscle that is the cervix, that's very laden with blood supply, and so it's really risky for mom to possibly bleed out. And then there's the possibility of harming the baby during the C-section. It's rare, but sometimes babies get cut during the C-section. And then, of course, in the aftermath of a C-section, the recovery is way harder on mom than a vaginal delivery is. And so there are infections and all sorts of things that can happen after a C-section that put mom at a higher risk than if she had a vaginal birth. So when we see it go from, at the time, we thought 22% was too high. And it seemed like too many of them were being done for convenience or just through elective stuff. So you see this little drop in the late 90s. There was a lot of education, stuff like that. They started to practice something called a VBAC, which is a vaginal birth after cesarean, so that moms who had cesarean sections for their first or second birth were now eligible to have a vaginal birth for their subsequent birth. And so a lot of women were taking advantage of that. But look what's happened since 2000. There's been a just exponential increase. We're at 30%, more than 30% now. This number stops in 2006. It's even higher than 30% today. So elective C-sections are on the rise. And then it puts moms are debating it because of course we always want to have justification for what we have done or chosen. So we have on the left, one blog which has selected some very medically accurate facts to talk about how planned cesareans can increase health risks in children. And it's true. Those are true statements. But then we have this defiant mom, Austin Mom's blog woman who she's like defiant. Why I had an elective C-section, and what she's got on her pictures are you grab your pitchfork and your rope because guess what? I had an elective C-section for no medical reason. And judge me all you want. So we have like this debate right now about which is okay. I'm going to tell you that there are risks associated with C-section, and that I would really hope that people who are listening to this piece would maybe, if you're thinking, oh, it doesn't really matter, things like that, maybe you would think about it again. I don't blame you if you don't. Just because you heard me say it, one of my best friends called me while she was pregnant with her third child. Her first had been born vaginally, her second had been born C-section, and she'd been given the option of a VBAC for her third child. And she asked me, which would you do? And I said, I'd go for the VBAC. And she had a C-section for the third one. So obviously my advice is not necessarily taken, but there are significant risks. And my friend turned out fine. But I have another friend who's had several C-sections and now has adhesions that are causing significant pain in her pelvic region. And so, these are things that, now may cause another surgery to try and fix the adhesions and, that aren't typically present in a vaginal birth. Most doctors recommend that if you've had 3 C-sections, you probably should not have any more children. And so if you're thinking more children, probably reducing the number of C-sections would be important also. So what about how quickly can we get back to sex? Because aren't we supposed to be talking about human sexuality here, right? So some postpartum issues. Sexual activities. Generally, you're advised after giving birth to resume sexual activity after about 6 weeks. I only wanted in this chart to look at the episiotomy rates. Episiotomy is when the doctor cuts the skin between the opening of the vagina and either the anus or somewhere around if you imagine I don't know if this is crude to say this, but imagine it's a clock. You're facing the clock, and the vaginal opening is the center. And if you imagine that the rectum is at 6, usually the episiotomy is performed somewhere in the 4 or 5 or the 7 or 8 position in order to make a little bit more room for the baby's head to emerge. Used to be pretty much everybody got an episiotomy during a vaginal birth. The assumption of the doctor was that a neat cut would heal better than a tear. So if you look at 1997, when episiotomy rates were already starting to decline, you see that 866 out of 1,000. So we'll call it 86% of births included an episiotomy. If you look at 2006, you see this decline in episiotomy rates. Now we're looking at 39% of women have episiotomies when they give birth. Doctors are realizing that actually a tear oftentimes heals much smoother than a cut. So episiotomy rates are on the way down. Why am I belaboring episiotomies? I thought we were talking about returning to sexual activities. Well, one of the limiting factors that had prevented women from getting back to having sexual activity was having an episiotomy scar, having stitches in your vaginal opening. So only about 30% of women today are having episiotomy. So that means that a large number of them can resume sexual activities maybe 4 or 5 weeks after giving birth. So we have fewer limiting factors. So episiotomy scars, C-section scars can also be limiting factors. You've cut through 2 layers of muscle and they need to heal, and so you don't want to be tearing or whatever. So you want to wait even longer if you've had a C-section. Lochia is the formal medical term for the blood that comes out in the days and weeks following childbirth, and that it's like a heavy period, and so while that's coming out, you certainly are not going to be having sex, and you probably shouldn't be having sex while you have a uterus that's trying to repair itself. So lochia is vaginal discharge that contains blood, mucus, and uterine tissue, all the stuff that you're shedding after giving birth. And it usually lasts 4 to 6 weeks. It can be much shorter if you're breastfeeding, much shorter, maybe more like 3 to 4 weeks. Which brings us to the issue of breastfeeding. So let me go ahead and take a break here, and we'll come back and talk about breastfeeding because I have a lot to say on that.